Johnston defines euthanasia as an instance in which a legally competent patient or client makes an informed and voluntary choice to have a medically assisted death, explicitly requests assistance to die, and gives informed consent for the actual procedure of euthanasia to be performed. In other words, a patient or client explicitly requests and voluntarily consents to a qualified medical practitioner to administer a lethal substance to cause immediate death. This form of euthanasia is also referred to as active voluntary euthanasia, because A, it involves actively bringing about a death by the deliberate administration of a lethal substance. This is opposed to passively bringing about a death by willingly withholding or neglecting to provide life-saving therapies such as antibiotics or mechanical ventilation. And B, death is chosen in a manner which is free of coercive or manipulative influences, as opposed to being imposed under duress or when unable or incapable of giving a free and informed consent. Euthanasia of the active or passive voluntary type is also referred to as consensual euthanasia. This is contrasted with non-voluntary or non-consensual euthanasia, which involves the act of killing a patient or client whose wishes cannot be known either because of immaturity, incompetence, or both.
The debate surrounding legalisation of euthanasia as an ethical medical procedure focuses on two forms: voluntary versus non-voluntary euthanasia. This table outlines the 6 types of euthanasia. For the purpose of our presentation, we will be focusing on physician-assisted suicide, which is sometimes used interchangeably with the term euthanasia, in which a qualified medical practitioner supplies a patient or client with the means of taking his or her own life, for example, providing a prescription for a lethal dose of drugs. However, unlike in the case of euthanasia, it is the patient or client, not the qualified medical practitioner, who kills him or herself. As such, physician-assisted suicide is often considered more defensible and hence preferable to active euthanasia, because A, the willingness by the patient to action their own suicide gives compelling evidence of the patient's desire to die, and B, a qualified medical practitioner supplies a means of taking a life, however, does not administer a lethal substance. Thus, a medical practitioner can gain some moral distance and be acquitted from full moral responsibility for the act, as his or her finger was not on the button.
As previously mentioned, there is a clear distinction between euthanasia and assisted suicide, and this ultimately affects the laws surrounding this issue. Euthanasia is when a physician administers the cause of death, such as a fatal overdose of drugs, while assisted suicide is when the means of death is provided to a willing individual and self-administered. In most countries, voluntary euthanasia and assisted suicide are illegal, and a person can face criminal charges if caught. Only 5 countries in the world are an exception: the Netherlands, Albania, Belgium, Colombia, and Luxembourg. Under certain and clearly specified conditions, both euthanasia and physician-assisted suicide have been legitimised in these countries, with laws of due care being made in order to determine physical and mental stability of an individual to make this decision. Dutch legislation, which came into effect in 2002, states that euthanasia and assisted suicide is a criminal act unless it is performed by a physician. The physician acts according to specified rules of care in the act, and the physician reports the case for review to the Belgian Consultative Committee of Bioethics. It is not necessary for the patient to be suffering physical pain. Unbearable mental anguish is sufficient. Similarly, there is no requirement for the patient to be in a terminal phase of an illness, or indeed to be suffering any physical condition at all. A physical disability or a condition of untreatable misery will suffice. Laws are similar in the remaining countries, with Belgium being recognised as the leading country in legislation of euthanasia. At the beginning of 2013, the Senate voted in favour of having their euthanasia laws to additionally govern terminally ill children. Understandably, the taking of a life in this way is a very controversial issue, which is why euthanasia is recognised as a crime globally, aside from these exceptions. But surprisingly, assisted suicide is more widely practiced. In Switzerland, assisted suicide has been possible since 1918, as long as there are no self-seeking motives and it does not require the involvement of a physician at any time. Meanwhile, in Germany, it is legal as long as the lethal drug is taken without physical help of a physician, such as lifting the patient's hand to their mouth. There are also 5 American states which allow it. However, each has their own governing laws over the matter. For a short time in 1996, Australia became the first country in the world to fully legalise active euthanasia after the Northern Territory put forward a controversial act making it available in the previous year. This act allowed an individual, after seeking signed permission from 3 medical professionals concurring with their decision, to actively end their life. The procedure was successfully completed by 4 people before the Australian federal government overturned the ruling, again criminalising all types of euthanasia and assisted suicides by the mid-1997.
When focusing upon the ethical standpoints within the euthanasia discussion, the arguments for the pro-debate can be split into 5 primary pillars, named autonomy, dignity, relief, justice, and altruism. Firstly, the ideal of autonomy is centered upon an individual's self-determining right to decide their own life circumstances. Autonomy, being one of the main medical ethical principles, can be adapted to euthanasia as an individual's right to have control over the timing, character, and circumstances of their own death. This also involves the concept that death is not a negative outcome, but yet a positive decision that an individual can autonomously make. The second pillar of the in favour argument for euthanasia surrounds the concept of dignity, whereby people have a right to upkeep their own dignity in life and should be spared from living a life deemed undignified. Particular examples of this case relating to euthanasia reside within a person who has been involved in a physically traumatic experience, whereby they have been left with a body they feel is no longer their own, and that of which they are ashamed of. In accordance with the dignity concept, this individual should have the right to opt for euthanasia, to spare living an undignified life, if they so wish to. The third pillar resounds around the argument for relief of pain and suffering. In these circumstances, this concept argues that it is morally unjust for a person to suffer trauma unnecessarily, and that an individual should be relieved of pain and suffering. Again, an example of this scenario may be found in some individuals riddled with diseases. Although they may have the capacity to live, they live in a state of an unbearable pain, and this construct argues that this state is inhumane and these individuals deserve the right to cut their lives short if they deem fit. The fourth pillar regarding the ethical standpoints towards euthanasia is the concept of justice and the demand for these individuals to be treated fairly. The approach in terms of justice revolve around the concept that the individuals are entitled not to carry a disproportionate burden of suffering compared to those who are not suffering would carry. In other terms, linking with the relief pillar, an individual who may be suffering in pain for an extensive period of time with no sign of improvement, and this pain is greater than that of which a regular person would be capable of dealing with, then this individual, should they choose to, should be treated fairly and have the option of euthanasia available to them. And finally, the fifth pillar supporting the pro-ideology for euthanasia is the argument for altruism, or the duty of death. In situations where resources may be scarce, caregivers can be burdened to the point where they can no longer live their own personal lives. In said scenarios, it is argued that an individual causing this strain should be able to conscientiously volunteer for euthanasia. For example, this may include a cancer patient whose medical bills are placing such a financial strain on their families and loved ones to the point where they can no longer survive on the money they have. Instead of continuing a treatment, this individual, in accordance with the altruism concept, should be able to opt for euthanasia if they deem fit, wishing to reduce this burden upon their family.
Medical miracle can also become a factor. A person may not suffer forever as is expected in certain situations. A person may get better, and that possibility is completely rejected when euthanasia comes into the picture. Physicians and other medical care professionals should not be involved in directly causing death. And finally, euthanasia could also become a restraint on the healthcare system and come with vast costs.
In addition, one of the main arguments taken by those who are against euthanasia is the ideology of the sanctity of life. Thereby, life is precious and taking it away from someone is wrong. This can include the religious argument that euthanasia is playing God and that nobody other than God himself has the right to end a life. The concept of euthanasia directly opposes the medical ethical principle of non-maleficence. The concept of non-maleficence entails that to cause harm to an individual, especially avoidable or intentional harm, is a breach of ethical conduct for a physician and therefore makes euthanasia an unethical practice. In reflection, our collective beliefs are that euthanasia should be legalised in Australia. My belief is that certain types of euthanasia should be legalised on the basis that it has certain restrictions, laws and criteria. Similarly, Bryn believes that people should have the autonomous right to choose the circumstances over their own death. Brenton's view towards this issue is that those suffering in pain should be able to end their suffering prematurely if they wish to. Michael believes that a doctor should give approval to those suffering terminal illness with the support of family and friends to allow them to be euthanised. Finally, Jessica is in agreement with the above reflections and personally believes that so long as a patient or client makes an informed and well-considered decision to end their life, then they should have the right to die.
Ultimately, there are 6 different types of euthanasia. Physician-assisted euthanasia is a voluntary form of active euthanasia. Physician-assisted euthanasia is when a qualified medical practitioner supplies a patient or client with the means of taking his or her own life. However, it is the patient or client who takes an active role in administering the lethal injection. In other words, the patient initiates and causes death to themselves rather than the physician. Physician-assisted suicide is generally viewed as defensible and is therefore seen as a preferable method over active suicide. From a legal standpoint, there are few countries which have adopted the right to allow citizens to voluntarily take their lives, whether by voluntary euthanasia or physician-assisted suicide. It is the opinion of most government parties that the moral and ethical ramifications are too great to allow for these legal undertakings, and that while there is an increase in many major health issues, legalisation of euthanasia in Australia is not a priority in the near future. The arguments submitted for those in favour of euthanasia surround the concept of autonomy, whereby individuals' free choice are at the forefront. Other arguments concern the ideology of the relief of pain and suffering and the duty of death. Ending a life in the form of euthanasia comes with these negative outcomes, and deciding to euthanize someone comes with many responsibilities and consequences. Positive promotion of euthanasia can help generate acceptance in the world. Understanding the facts and outcomes of euthanasia allows individuals to have their own awareness and beliefs in the subject.